surge in coronavirus cases has some local health experts recommending all schools move to all virtual learning. Joining us now this morning live to discuss this new guidance is Dr. David Rubin, who is the director of PolicyLab at the Children's Hospital of Philadelphia and also a professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania. Good morning, Dr. Rubin. Good to see you.
Good to see you.
All right, so everybody, listens very closely as to the directions or the recommendations that the PolicyLab makes. What went into this recommendation to move to all remote learning? What's your biggest concern right now?
Look, I just want to say, since March and April, we've been doing weekly forecasts to help people understand the direction of this epidemic. And over the last few weeks and a couple months, we've been seeing obviously cases rise throughout the country. And we've been able to observe what's going on in the Midwest and the mountain states. And over the next 4 weeks, we are seeing considerable rises in the forecast, not just for cases, but hospitalizations. The use of ventilators in our region, they're already starting to go up. We're just a few weeks behind what is going on in the Midwest and the mountain states. And we know now, when we look at that, we foresee, our hospitals have great capacity right now, but we want to avert a major crisis in holiday season, recognizing that this is happening at the wrong time for us in the Philadelphia region. This is right before two major holidays, Thanksgiving and Christmas, where we suspect there's going to be a lot of transmission. We knew that a week after Halloween, for example, we've seen a major surge. We got deluged over the last week in terms of the number of cases that we've seen throughout the region, particularly in kids following the Halloween holiday. And now we're looking at Thanksgiving and Christmas. And so, I think that, when people heard that we recommended moving kids to virtual, I think in many ways, it comes off as if that was our primary response. But truthfully, it's part of a collective response. We now know that all people have rising infections in terms of COVID.
Right.
We have to assume that kids are now transmitting this virus as much as adults are, given the rates of infection we now see in kids. And really, if our goal is to interrupt transmission at Thanksgiving and just after, or at Christmas, we have the opportunity to take advantage of our knowledge that we expect potential transmission there for those families who choose to get together, and say to ourselves, look, we have to have a collective action here where everyone, not just the children, where we return as many of our workers to alternative work arrangements, where we restrict our gathering sizes significantly.
Yeah, and there's concern.
Yeah, when we close our bars, it's not just the kids. I think everyone, we try to go into a relative quarantine before and after the holidays. And what we're not saying is that we should close schools indefinitely. We're trying to do this during the holiday period as a way to interrupt transmission during Thanksgiving and Christmas.
All right, which a lot of people can understand. That said, last night there was quite a contentious Zoom meeting between concerned parents and guardians and members of the Montgomery County Board of Health about the prospect of going all digital. We're going to play a comment from one of the parents and I'll get your response on the other side. Let's take a listen.
Our children's families' mental health is in serious jeopardy. All kids, no matter what age, kindergarten to 12th, have a right and deserve to be in school.
And you heard her say it there. A lot of parents are concerned about the mental health of their children if they're not able to interact with their peers. They're concerned that they won't retain what they're taught in the classroom. What's your response to that?
Look, I feel for the comments that were made. I mean, we're acutely aware of the emotional trauma that this has caused for everyone, particularly our kids. But I think we have to differentiate the entire response over the period because we support kids being in school. We think schools are a safer place, but we have to assume at these very, very high rates and just before Thanksgiving, we have to start thinking about this in smaller blocks. And I think that's what I would distinguish for those who are worried about kids being out of school. Our goal right now is to focus on Thanksgiving, the next 3 weeks. And if we can interrupt as much transmission as possible before Thanksgiving, not just with kids, being virtual at school, but restricting our gatherings, having as many adults home as possible, that we have an opportunity here to prevent a real surge in our area that would threaten the capacity of our hospitals to care for the sick. And I think we have to just look at it in that narrow window, and as soon as these holidays are over, is return kids to schools, because I agree with them. I agree with that woman in that video. We need to get our kids back to school, but we're not going to be staring down the lens of two major holidays after the new year, and I think that's a different calculus.
All right, Dr. David Rubin, the director of the PolicyLab at Children's Hospital of Philadelphia. Really appreciate your insight and your time this morning. Thanks so much.
You're welcome.